Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Usher syndrome. Introduction. Usher syndrome is an inherited disease. It is the most common condition that affects both vision and hearing. Usher syndrome causes serious hearing loss. It also causes an eye disorder that causes your vision to worsen over time called retinitis pigmentosa or RP. This program explains Usher syndrome. It discusses symptoms and causes of the condition as well as treatment options. Types of Usher syndrome. Approximately 3 to 6% of all children who are deaf and another 3 to 6% of children who are hard of hearing have Usher syndrome. The syndrome was named for Charles Usher, a British eye doctor who was the first to recognize that the condition was inherited. There are 3 clinical types of Usher syndrome: Type 1, Type 2, Type 3. Types 1 and 2 are the most common types of Usher syndrome. Together, they account for approximately 90 to 95% of all cases of children who have Usher syndrome. People with Type 1 are deaf from birth. They have severe balance problems from a young age. Vision problems usually develop by age 10 and lead to blindness. People with Type 2 have moderate to severe hearing loss but normal balance. Vision problems develop in the early teens and progress more slowly than in Type 1. People with Type 3 are born with normal hearing and near normal balance, but they develop vision problems and then hearing loss later in life. Symptoms. The major symptoms of Usher syndrome are hearing loss and an eye disorder called retinitis pigmentosa or RP. RP causes night blindness. Night blindness is the inability to see well at night or in poor light. RP also causes a loss of peripheral vision or side vision. RP weakens the retina, the light-sensitive tissue at the back of the eye. As RP progresses, it causes tunnel vision. Tunnel vision is the narrowing of your field of vision until only central vision remains. Central vision is your ability to see straight ahead. Many people with Usher syndrome also have severe balance problems.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. Usher syndrome is inherited, which means that it is passed from parents to their children through genes. Genes are located in the body's cells. Genes contain instructions that tell cells what to do. Every person inherits 2 copies of each gene, one from each parent. Sometimes genes change or mutate. Mutated genes may cause cells to act differently than expected. Usher syndrome is inherited as an autosomal recessive trait. The word recessive means that, to have Usher syndrome, a person must receive a mutated form of the Usher syndrome gene from each parent. If a person only has one mutated Usher syndrome gene, then they are called a carrier. Carriers do not have Usher syndrome, but they may pass the mutated gene onto their child. If both parents are carriers of a mutated gene for Usher syndrome, they will have a 1 in 4 chance of having a child with Usher syndrome with each birth. Parents who have normal hearing and vision usually do not know if they are carriers of an Usher syndrome gene mutation. It currently is not possible to determine whether a person who does not have a family history of Usher syndrome is a carrier. Diagnosis. Early diagnosis of Usher syndrome is important. The earlier parents know their child has Usher syndrome, the sooner that child can begin special educational training programs. These programs help a child to cope with hearing loss and vision problems. Because Usher syndrome affects hearing, balance, and vision, diagnosis of the disorder usually includes the evaluation of all 3 senses. To diagnose Usher syndrome, a healthcare provider will perform a physical exam on your child. He or she will ask questions about your family and your child's medical histories. Eye tests may include a visual field test to measure peripheral vision, a retinal exam to look at the retina and other structures in the back of the eye. An electroretinogram, or ERG, is another eye test that may be done. This test measures the electrical response of the eye's light-sensitive cells. An electronystagmogram, or ENG, can also help diagnose eye problems. This test measures involuntary eye movements that could indicate balance issues. Your child's healthcare provider will also perform a hearing evaluation. This test will measure how loud sounds at a range of frequencies need to be before your child can hear them. It can tell how much hearing loss your child has, if any. Treatment. There is no cure for Usher syndrome. The best treatment involves early diagnosis so that educational programs can begin as soon as possible. Treatment often includes hearing aids and assistive listening devices, cochlear implants, teaching of other communication methods such as American Sign Language or Braille. Hearing aids are small electronic devices that you wear in or behind your ear. They magnify sound vibrations entering the ear. This makes some sounds louder. A cochlear implant is a small, complex electronic device that can help provide a sense of sound. The implant consists of two parts. One part sits on the outside of the body, behind the ear. A second part is surgically placed under the skin. American Sign Language, or ASL, is a complete and complex language. A person can communicate using ASL with signs made by moving the hands. The signs are combined with facial expressions and postures of the body. Braille is a series of raised dots that can be read with the fingers by people who are blind or whose eyesight is not sufficient for reading printed material. Braille is not a language. It is a code by which languages may be written and read. Treatment may also include auditory training, independent living training, low vision aids such as magnifiers and special eyeglasses, orientation and mobility training. Some healthcare providers recommend a high dose of vitamin A to slow the progression of RP. Researchers recommend that most adult patients with the common forms of RP take a daily supplement of 15,000 IU of vitamin A under the supervision of their eye care professional. High-dose vitamin A is not recommended for patients with type 1 Usher syndrome. This is because more research needs to be done on the effect of vitamin A on people with type 1 Usher syndrome. People who are considering taking vitamin A should discuss this treatment option with their healthcare provider. This is especially important if you are considering getting pregnant.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. There are 3 clinical types of Usher syndrome: Type 1, Type 2, Type 3. Types 1 and 2 are the most common types of Usher syndrome. Together, they account for approximately 90 to 95% of all cases of children who have Usher syndrome. People with Type 1 are deaf from birth. They have severe balance problems from a young age. Vision problems usually develop by age 10 and lead to blindness. People with Type 2 have moderate to severe hearing loss but normal balance. Vision problems develop in the early teens and progress more slowly than in Type 1. People with Type 3 are born with normal hearing and near normal balance, but they develop vision problems and then hearing loss later in life. The major symptoms of Usher syndrome are hearing loss and an eye disorder called retinitis pigmentosa, or RP. RP causes night blindness. Many people with Usher syndrome also have severe balance problems. Usher syndrome is inherited, which means that it is passed from parents to their children through genes. There is no cure for Usher syndrome. Early diagnosis of Usher syndrome is important. The earlier that parents know if their child has Usher syndrome, the sooner that child can begin special educational training programs. These programs help a child to cope with hearing loss and vision problems.
Thank you for using Explain.